Germany. And then what are the most common physiotherapy services provided in Germany, or as usual in India, they have the most common is orthopedics, and second in orthopedics also geriatrics is most common because German population is around say 84 million. In that, most of them, like around say around 20 to 30 percentage are old people, and young people are really less. And those young people who are really less are also highly active in sports. So physiotherapists are really having a very high demand because of more number of geriatric patients and the very active young school and college and young communities. And in case of working communities also, the trend is that there are more work from home people now, right now, and they are also getting back pain and neck pain because of work from home. They don't have a good proper home office. Okay, and geriatrics are done, and neurologics is they have just like India, they have the basic neurological setup here. Rehabilitation setups are also here, and pediatrics also here. And in case of neurologic and pediatric, the stream is a bit separate. You have to do additional higher certifications, which I'll talk about in the next slides. Okay, and what are the physiotherapy service outlets? First is private practice. Almost 80 percentage of the jobs are private practices. Uh, Practice I'm saying here, which is private practices, and it is actually the fastest growth route for any physiotherapist. And there is also, you can eventually learn how the system works and how the billing works, and you can start your own clinic in a very few years, maybe 1 or 2 years. You can start your own clinics. But according to the visa, if you are paying your taxes for 3 years, then you will be allowed to start your own business here in Germany. And second common is hospitals. Here the pay is a bit less, but it is more relaxed. In case of private practice, each and every treatment session is 20 minutes. So imagine for 1 hour you are treating three patients, and imagine for a day, 8 hours, you have to treat more number of patients. You are lucky if you are able to find a practice which is having half an hour session or which is having 1 hour session. It is very, very rare, but it is very lucky. And in case of hospitals, it would be around 45 minutes for each and every patient. So it's a bit relaxed setup. Or maybe in rehab care is also relaxed because you may have 1 or more than 1 hour because it's rehabilitation of the patients. And here the growth is also a bit slow. The salary is a bit constant. You do not get a very fast increments in these things. In private practice, you may get fast increments. There is also exotic choices. Like say you can get a job as a physiotherapist in a cruise ship. So and also holiday resorts. There is also a very high trend here going on that physiotherapists are getting employed in holiday resorts, golf resorts, and the patients get sports. They have the sports vacation there. So it's really a very nice option also. So what are the common prescriptions from the doctors to physiotherapists about the treatment? Well, the first most common any doctor is going to be prescribed for physiotherapy is crank and gymnastic, and it means that well, there is no actually exact term for crank and gymnastic in English. Cranken means sit, gymnastic means exercise actually. So maybe they are talking about exercise therapy. Okay, but when a patient coming to me for crank and gymnastic, I used to provide uh, every treatment what I'm allowed to provide actually. Okay, not just exercise therapy. And you're also allowed to treat the patient in the treatment table for crank and gymnastic. And crank and gymnastic, I'm great. It means that exercise therapy at machine, like in the gym. Yeah. So that is not allowed to treat in the treatment table. For this, you have to for the crank and gymnastic, you are allowed to provide the treatment right after your recognition as a physiotherapist in Germany. You don't need any additional qualification. But for KGG, you have to do additional 3 days of workshop. And for manual therapy, you have to do after registering here as a physiotherapist, you have to do additional 2 to 3 years of part-time course. Like in this part-time course, why it is 2 to 3 years means they have placed the course in such a way that you have 4 days of intensive classes, and then 3 months of practice in your practice, and then another 3 to 4 days of classes. It happens periodically every 3 to 4 months. So that is structured to be finished at least in minimum 2 years, or maximum 4 5 years also you can take it, no problem. And then manual lymphatic drainage is an intensive program. It's an intensive certification program. Lymphatic drainage, and we must have learned in India, or you may not have learned it, but doesn't matter. You don't even have to learn manual therapy also in India, because you are going to come and learn everything again here, except the exercise therapy, electrotherapy, all those things. You have to learn everything again here in German language as an additional certification. And this is a 4 week intensive course. And then next one is KAGE, Central Nervous System. It's for neuro. If you are getting this certificate, you are allowed to treat neuro patients, including PNF, Bobath, Osta technique. Exactly. In Bobath and Osta, you have both for adults and also for the kids. And then Vampakung and Fango, it means heat pack. It can be done right after your basic physiotherapy qualification. You don't have to do any additional certifications. For classic massage, also you don't have to do any additional qualifications. For electrotherapy, also you don't have to do any additional qualifications. And then CMD means temporomandibular joint actually, and here they say craniomandibular joint. Okay, and it requires 3 levels of certifications, and each are also 3 days of workshops. And then sports physiotherapy, you are allowed to practice, but you are encouraged to do additional certifications here also. So these are the common treatments as a physiotherapist. And now, what are the advantages of coming to Germany as a physiotherapist? So it's an ever-growing economy, and as an increased elderly population, we are really highly wanted profession. Every physiotherapy clinic needs a physiotherapist, and every physiotherapy clinic is highly occupied. And the culture is non-judgmental. They don't care what you wear, what you have tattoo. Nothing matters here. There is a very good work-life balance, as Apurva was saying. You are signing up for the number of hours, and so you just have to work on those number of hours. Pay hike is proportional to the certification. It is not that you are 10 years experience in India, you are getting more salary here. It is about the number of certifications you are doing here, your pay is high. And there is a very good intercultural experiences here. Not just Germans are there. See, in India, we are meeting 95% of Indians, and foreigners we are seeing very, very less, only as tourists. But here, there are foreigners who are having their life, their family, their source of income. So you have a very nice intercultural exposure, and the nature is also very beautiful, and the cities are. If you are coming here, I would recommend to go out each and every weekend to visit each and every city, and it's not very expensive, because in Germany there is a public ticket called Deutschland ticket. They call it German ticket. It means that for that now €49 monthly, you have a monthly subscription ticket, and you are allowed to travel in trains across Germany, anywhere, and except ECE. ECE means it's intercity express. That is very fast. You are not allowed to take that train, except that all the small short destinations, or you are allowed to take it. And there are very, very, very attractive social welfare benefits. For example, when I told you that I got employed, and then right after 1 month I was living in the home for lockdown, I was getting paid salary. So it was very lucky that I just got paid. Even I just enter the job, I was employed, and then within 1 month I was living in the home and get paid. So it was really lucky. So that kind of social welfare schemes, like in case of crisis, you will be getting paid. In case of your accidents, you're getting paid. All medical is free. There is a maternity leave paternity leave is there for both mother and father. It's a leave, and you have free education. Pension is mandatory. So if you are living more than 5 years, if you are living more than 5 years in Germany and working and paying taxes for 5 years, then you are eligible for Rentenversicherung. It means pension insurance. I mean, you will get pension after you retire. Okay. And what are the disadvantages? Everything has pros and cons, right? So what are the disadvantages here? Well, it's not always beautiful, sunny, and the nature is beautiful. There are months, like say from November to March. These months are a bit cold, and there are not too many people on the streets. It will be bit like a zombie area, and there is a political right wing is also growing. It's I think it's a world trend. Even in India, also I think the right wing is growing. Here is also the right wing is growing. The labor and work expensive is the labor force is expensive. Like say for example, if you want to change a doorknob in India, what would you do? You may have to spend couple of hundreds. That's it maximum. But here you may have to spend 30 to 40 euros just for, I mean, that is very less. 30 to 40 euros is very less. You may have to spend around 50 euros just to change the doorknob. So the labor works and hand workers are expensive. Even maid is very expensive. You can't have maid. If you are having maid, you have per hour you have to pay 12 euro. But you are getting around 18 to 20 euro. And when you are coming as single, so you may feel a bit lonely. As I said, 5 months is a bit gloomy. But the good thing is, the basic salary would be average 3,200. Do not go for a lesser salary. I know that some agencies in India are promising a lesser salary because they are not bringing you to Germany as a physiotherapist. They are bringing you to Germany during your qualifications. So you are getting a job as a non-physio, like as a caretaker or so. Then you get the minimum salary, the 12 euro calculation, minimum salary. So that is 2,300 euro. But you are, if you are able to finish German language B2, then you are eligible to deserve a higher salary. Average is 3,200, minimum 3,000 euro. Less than 3,000 euro, you can really bargain about it. Okay, so now you can decide if you want to stay here in India or leave to Germany. Let's say for who it is better to stay in Germany, stay in India. If you do not have to make more money to support your family, if you need to stay close your near and dear ones all around the year, then it's better to stay in India. And if you do not like solitude lifestyle, but if you are a free bird, if you like to experience different culture, if you like the nature, and if you want to be financially independent, then it's better to leave to Germany. So this is the end of the first presentation.